For seniors, the vital importance of restorative sleep. For those in their golden years, sleep is far more than a period of rest. It is a vital time during which the body and brain repair and rejuvenate themselves. Today, many seniors find themselves in a cycle of sleep debt due to staying up too late or not obtaining enough sleep. This disruption in natural rhythms not only undercuts daily vitality but also conceals long-term health risks. In this comprehensive guide, we delve into the multiple dangers associated with late nights and inadequate sleep, using vivid examples and practical recommendations to help you reclaim quality sleep and enhance your overall well-being. The hidden risks of staying up late. 1. Disruption of the biological clock. When night falls, our bodies are programmed to transition into a restorative mode. However, when seniors consistently stay up late, that crucial period of repair is delayed. As the natural sleep-wake cycle becomes disrupted, hormone secretion falls out of sync. This often results in insomnia or premature awakening in the morning, thereby depriving the brain of the deep rest it needs. Over time, such disturbances may heighten the risk of neurodegenerative conditions such as Alzheimer's disease. Case study: Mrs. Smith, who had long relied on watching television well into the night, found that she would frequently wake in the middle of the night, often unable to return to sleep. Over the years, this pattern steadily diminished her memory and attentiveness. 2. Increased cardiovascular strain. Staying up late can interfere with the normal transition of our autonomic nervous system. At night, the natural decline in sympathetic activity which helps lower blood pressure is disrupted. For seniors, this means that blood pressure may fluctuate unnaturally during the night, potentially triggering irregular heart rhythms. Over the long term, such stress can contribute to arterial hardening, thereby increasing the likelihood of heart disease and stroke. Case study: Mr. Johnson, known for his habitual late nights, began experiencing frequent palpitations and chest discomfort. A medical evaluation revealed abnormal heart rates during the night. Once he adjusted his sleeping schedule, his cardiovascular symptoms gradually improved. 3. Metabolic dysregulation. Late nights can also disturb the body's delicate balance of insulin and other metabolic hormones. When sleep is shifted to later hours, the normal regulation of blood sugar suffers, making it more difficult for the body to manage glucose levels. Simultaneously, immune function may decline, lowering the body's resistance to infections and other illnesses. Pro tip: it is advisable for seniors to schedule evening activities earlier and to strive to maintain a consistent sleep schedule. This helps keep the body's internal balance in check and supports long-term metabolic health. The gradual impact of sleep deprivation. 1. The silent killer of cognition. Deep, restorative sleep is crucial for the brain's cleanup processes, such as the clearance of metabolic waste products like beta amyloid. In the absence of sufficient deep sleep, these harmful proteins can accumulate in the brain and gradually erode the neurons in the hippocampus, the region responsible for memory. Inadequate sleep may therefore lead to cloudy thinking, diminished cognitive abilities, and an increased risk of learning difficulties. Case study: Mrs. Brown, who grappled with constant anxiety over everyday matters, discovered that her lack of sufficient sleep left her with a persistent brain fog. Even simple calculations became challenging. After her family encouraged adjustments to her daily routine and sleep schedule, she noticed a marked improvement in both her memory and reaction times. 2. Mood swings and psychological distress. Sleep is not just about physical repair, it also plays a critical role in maintaining the balance of neurotransmitters such as serotonin and dopamine, which regulate mood. When sleep is insufficient, these chemicals can fall out of balance, making an individual more prone to feelings of depression, anxiety, or irritability. If these mood disturbances persist, they may evolve into more serious psychological issues such as clinical depression or anxiety disorders. Case study: Mrs. Davis was often described by her friends as subdued and lacking energy. Her chronic sleep problems affected her emotional state so profoundly that she experienced frequent bouts of low mood. With the help of professional counseling and improved sleep hygiene, she eventually regained a more optimistic and balanced outlook on life. 3. Accelerated physical decline. Adequate sleep is essential for the synthesis of proteins that maintain muscle mass and bone health. Without enough rest, seniors may experience a reduction in muscle strength and coordination, significantly increasing the risk of falls and fractures. This decline not only impairs mobility but also affects overall independence. Recommendation: for seniors with limited mobility, establishing a stable sleep pattern is crucial. Such a routine helps preserve muscle strength and coordination, thereby reducing the likelihood of falls and promoting a more active, independent lifestyle. Practical guidelines for restoring quality sleep. 1. Develop and maintain a consistent sleep routine. Set fixed bedtimes and wake-up times. Strive to go to bed and to rise at the same time each day, even on weekends. This consistency helps recalibrate the body's internal clock, thereby reinforcing a natural sleep rhythm. Optimize your sleep environment. Create a serene and comfortable bedroom by ensuring the room is quiet, dim, and maintained at a moderate temperature. Investing in ergonomically designed mattresses and pillows can alleviate discomfort and reduce nighttime tossing and turning. Engage in gentle afternoon exercise. Consider engaging in light physical activities such as walking or Tai Chi in the early afternoon. These activities can help promote better sleep quality at night. 2. Adopt pre-bedtime relaxation techniques. Limit stimulants. Avoid caffeine and alcohol in the hours before bedtime. Additionally, reduce exposure to blue light from electronics, as it can delay the onset of sleep. Create a calming ritual. Develop a habit that signals to your body that it is time to wind down. This might include taking a warm foot bath, listening to soothing music, or practicing simple meditation techniques. Such rituals can help ease the mind and signal to the body that it is time to transition into a restful state. Cultivate a positive mindset. A calm and positive attitude is essential in combating insomnia. Techniques such as gratitude journaling or engaging in deep breathing exercises can be beneficial in promoting a peaceful mindset prior to sleep. 3. Prioritize sleep quality and seek professional support when necessary. Regular sleep assessments. If sleep disturbances persist, schedule periodic evaluations of your sleep quality. These evaluations can help identify patterns or underlying issues that may require attention. Consult healthcare professionals. Sometimes, targeted interventions such as cognitive behavioral therapy for insomnia (CBTI) or, when necessary, pharmacological treatments are required to re-establish healthy sleep patterns. Working with healthcare providers ensures that you receive a personalized approach to addressing your sleep issues. Rely on family and community support. Emotional support from family and friends can play a significant role in reducing stress and anxiety related to sleep. Engaging with support groups or local communities devoted to senior health can also offer valuable insights and encouragement. Embracing quality sleep as the cornerstone of health and vitality. Quality sleep remains the cornerstone of health and vitality for seniors. Whether it is the disruption of the biological clock due to late nights or the cognitive and physical decline spurred by sleep deprivation, the consequences can be profound and far-reaching. By establishing consistent daily routines, optimizing your sleep environment, implementing pre-bedtime relaxation techniques, and seeking professional help when necessary, every senior can gradually reclaim the serene nights needed for proper healing and renewal. Just as a perfectly brewed cup of herbal tea requires the right temperature and timing to extract its full flavor, restorative sleep infuses the later years with renewed energy and clarity. By paying close attention to the signals your body sends and by making the necessary adjustments to your nightly routine, you not only safeguard your cognitive abilities and physical health but also set the stage for a more vibrant, independent life. May every senior discover the rhythm of peaceful sleep, a rhythm that transforms restless nights into moments of healing and quiet strength, ensuring that each new day is met with energy, clarity, and the promise of better health.